I'm going to go ahead and start recording. So thank you all for being here today. I'm going to turn it over to Dr. Ola Friday to get us started. We'll hear from her and then from Dr. Caitlin McLean before we move on to our state speakers. So Ola, go ahead.
Great. Thank you so much, Arabella, and good afternoon, everyone, and welcome. I am so glad that you are all here for our first webinar around the compensation capacity building grants and community of practice. As Arabella said, my name is Ola Friday, and I am the Executive Director of the Early Educator Investment Collaborative. And I want to just start by briefly grounding us in a bit about who the collaborative is, why we created this grant opportunity, and how we see today's conversation fitting into a larger body of work. So really briefly, the Early Educator Investment Collaborative is a national funder collaborative. Our role is to invest in and support work that strengthens the early childhood educator workforce, particularly around educator preparation, compensation, and the systems that connect the two. We partner really closely with public agencies, nonprofit intermediaries, higher education institutions, and other field leaders because we believe that durable change only happens when those parts of the system all move together. And this grant opportunity really grew out of a recognition that current systems are not designed to support durable compensation improvements, and that public agencies are often asked to solve this problem without the capacity they need to do so. And, we've all known for a long time that compensation deeply matters. It affects educator well-being, workforce stability, quality, equity, and the long-term sustainability of early childhood systems. And we also know that what has been harder to solve is how public systems actually finance professional compensation in ways that are durable, equitable, and aligned with preparation and career pathways. Too often, compensation improvements depend on short-term funding, isolated pilots, so one-time investments. We all are coming out of the ARPA era, so we know all about that. But these investments are oftentimes disconnected from underlying fiscal and governance structures. And when that happens, we see that progress is really fragile and that the systems revert back as soon as the funding shifts or stops. And so this is part of why we were very intentional in calling this a capacity building grant, right? As a funder, we understood that meaningful financing reform requires public agencies in particular to strengthen their ability to navigate complex funding streams, data, policy, and governance challenges over the long term. So this work is not only about implementing new ideas in the immediacy, it's also about building institutional capacity to carry those ideas forward for the long term. In this grant, we were also really intentional about requiring cross-agency and cross-discipline partnerships. The grant explicitly called for collaboration between content experts who understand early childhood systems and finance experts who understand budgets, revenue, and fiscal rules. Right? Our viewpoint was that neither group can solve this compensation challenge alone, and that durable systems change requires both, really working together with shared authority and accountability. But ultimately, we were looking to resource financing innovation, and that meant supporting work on revenue generation, fiscal coordination, data, governance, and enabling policy conditions rather than just focusing on compensation as a standalone workforce issue. So we put out this grant opportunity and we were really encouraged by the response. We saw a lot of strong interest from states and localities across the country. And that interest really signaled to us that many leaders are willing to grapple with the complexity of this work and to work across agency boundaries and to question longstanding assumptions about how early care and education is financed. Unfortunately, we were not able to fund every strong proposal we received, but we were able to invest in 5 projects that truly reflect bold and thoughtful approaches to this challenge. These projects are led by state and local partners who are doing the real work of testing, implementing, and refining their strategies in their context. Also, just as important as the grant themselves is also how we've been supporting learning alongside the work. So in addition to providing the funding, the collaborative also supports a community of practice that's led by CSCCE. And the community of practice is a structured learning space that allows the teams to learn from one another, access targeted technical assistance, and problem solve in real time as they navigate their policy, fiscal, and operational challenges. And the community of practice also allows for lessons from this work to be surfaced and shared more broadly, which brings us to this webinar today. We believe that learning is valuable, not just for the grantee partners, but for all of us who are thinking about how to better align preparation, financing, and compensation systems. And so this webinar is a part of our commitment at the Collaborative to support learning in the open. And so we're sharing about this work, not because it's finished, but because we know that there is so much to be learned from these strategies to inform the decisions of others who are engaged in similar efforts. So thank you all for being here today. We're really excited for the conversation. And I will turn it back over to Arabella and the team at CSCCE to get us started.
Thank you so much, Ola. Welcome, everyone. My name is Dr. Caitlin McLean, and I'm the Director of Multi-State Programs at the Center for the Study of Child Care Employment at UC Berkeley. And if you're on this call, then you already know that we have a compensation problem in the early care and education field. We know that early childhood educators are working with young children in homes, in centers, in schools across this country every day, doing important, complex work, but are not getting the recognition and the pay and the supports that they deserve. In fact, they are consistently paid less than almost all other occupations in the United States, as our center's own research has repeatedly shown. So that's the bad news. The good news is there's a lot that can be done about this. And today we're really going to focus on how leaders across the country have been stepping up to find ways to move toward that professional pay and benefits that we all know early childhood educators should have. Our own research center has been incredibly proud to host the Compensation Capacity Building Community of Practice in partnership with the Early Educator Investment Collaborative, as well as our partners in Minnesota, Colorado, Louisiana, Illinois, DC, and in Tarrant County, Texas, several of whom you'll hear from very shortly. And as Ola mentioned, we've been working with these states and local communities over the past year, providing peer learning support and technical assistance, as well as sharing takeaways with the wider field, as each of these teams devises really innovative ways to improve early educator compensation. And we'll continue to work with our partners throughout 2026. But our research center has been studying compensation strategies for decades. In fact, our founding director, Dr. Marcy Whitebook, was actively involved in the worthy wage movement led by educators fighting for better pay. And in more recent years, our center has been tracking and analyzing different initiatives to boost wages, to provide benefits at both the state and the local levels. And we've created a public database where folks can go in and see what are we doing across the country to try to address this issue. We've also worked directly with state and local leaders, first through our previous Bold on Compensation Learning Community cohort, and now through this current Compensation Capacity Building cohort. And through both of these cohorts, we've also been conducting research case studies to really understand how are people actually making progress on compensation in their communities. So we've learned so far from New Mexico, from North Carolina. We're about to release another case study about Minnesota, and we'll be conducting a fourth case study over the next year. And throughout all of these bodies of work, but especially through our case studies, we see key lessons for success repeat over and over, and which you'll hear more about from our panelists shortly. We all know how crucial sustained funding is for being able to really create and invest in compensation-focused policy solutions. We've seen states make strategic use of federal funding, but we've also seen states secure their own revenue to invest in early care and education programs and in those policy solutions that really focus on increasing educator pay and providing access to benefits like health insurance. But in order to bring this into being, there is incredible value in strong leadership and bold vision, including within state departments or agencies. But we also know that state agencies can't do this work alone. To truly bring about lasting and meaningful reform requires community organizing and educator activism. Early childhood educators empowered to stand up and demand better working conditions, demand public investment in their field. That is really where the power lies to make change. And all of us within the early childhood space have roles to play as allies in that mission. We know that progress on early childhood educator compensation is within our reach, even in these particularly difficult and unprecedented times. And I'm so excited for you to hear directly from these leaders on what they've accomplished so far. So with that, I'll turn it back over to you, Arabella.
Great. Thank you so much, Dr. Friday and Dr. McLean. Really glad to have you guys set the tone and get us started. I'm going to give you a little preview of who we're going to be hearing from today before we turn it over to the states. So we are joined by Michelle Stillwell-Parvensky from the Colorado Department of Early Childhood. We'll then hear from Dr. Candace Weber with the Louisiana Policy Institute for Children and Rochelle Wilcox with For Providers by Providers for our Louisiana team. And we'll close it out with Angela Boutel in the Minnesota Department of Children, Youth, and Families. So I'm going to turn it over to Michelle to get us started. And I see folks already using the Q&A. If you have any questions for our speakers while they're presenting, please go ahead and drop those in the Q&A. We'll have some time for audience questions at the end of our session today. So Michelle, the floor is yours.
Great, thank you. I am Michelle Stoll-Parvensky with the Colorado Department of Early Childhood, and we really appreciate all of the support from the center and from this compensation community of practice as we dive into these really important issues. And we're really deeply grateful to the Early Educator Investment Collaborative for funding Colorado's advancement of our ECE compensation goals, which we really see as central to the collective vision we have in the state for a future where all of our children are valued and thriving. So standing on the shoulders of early educators, providers, and advocates who have been tirelessly championing this cause for decades, Colorado has, under the leadership of our current governor, Polis, prioritized early childhood. So in 2022, we created a new unified state agency for early childhood and launched a mixed delivery system for a universal preschool. But we know that early childhood educators and professionals are the foundation of our early childhood system. And that's been a really deep and continuing commitment from our state. So if we go to the next slide, you'll see here our vision for ECE compensation, which is grounded in the truth that we know, probably everybody on this call knows, that a thriving workforce, which is one that is fairly compensated, qualified, and supported, is critical to supporting safe and responsive care for children. And we have seen through our research and through what we see in classrooms and in homes that compensation is the linchpin for three different things: for recruitment and retention to ensure families actually have access to care, to the quality of interactions in classrooms and homes for between our educators and our children, and recognizing the long undervalued professionals that are doing this really essential work. So to that end, we know that we need sustained, meaningful salary increases that early educators see in every paycheck. And a goal for us here in Colorado is really incentivizing and recognizing our early educators who have higher qualifications. And so that has been a root of the work that we've been doing, continuing to do, funded with by EEIC and others, towards this vision of all early childhood educators are compensated at or above our target salary scale, which I'll talk about briefly in a second, but which needs to be aligned with K-12 parity and living wages. So if we go to the next slide, uh, we'll see just a little bit of information about our salary scales, which we developed as an aspirational salary scales to guide how wages should function to achieve, again, that pay parity with K-12 educators, noting that in Colorado, our K-12 educators are also paid too little and connected with living wages for every one of our educators. We had developed salary scales that honors educators' credentials, the differences in costs of living across the state, and differentiated by job roles. And the intention with these salary scales was not to be an unfunded mandate for providers or an expectation that families pay more, but as that aspirational point of where we know we need to get. And I'll also just note that we know that wages alone are not enough. So we've also been looking really closely at benefits with a particular focus on health insurance, retirement, and paid time off, which were identified as the most important benefits by educators in our surveys. And so I think we're going to share in the chat both the salary scales if people want to dig into that in our task force report, as well as a benefits research study that provides a lot more of an in-depth look at some of the considerations around benefits. Next slide. So from those salary scales through our EEIC grant, we've been able to fund a workforce evidence building hub at the University of Denver's Colorado Evaluation and Action Lab to provide a really necessary research backbone for this work. And it's going to provide some really useful information that I think will be relevant for the whole country and those of you who are working on compensation issues. So we'll be glad to share those reports as they come through. This slide is just one snapshot that I wanted to provide that is a snapshot of a baseline wage analysis. So it confirms what we all know in terms of the low wages that exist in our field. But this analysis has also really provided insight into the wage differentials that we have by job role, by credential, by region, race and ethnicity, the type of program, to have a much more nuanced view of where we are with wages. And one of the things I'll just note from this is that you just see for our family childcare providers that they're kind of compensated at the same level as assistant teachers. So it's clear that there needs to be an intentional inclusion of family childcare providers in our work. The rich data also helped us quantify what the gap is between where we are and those aspirational salary scales that I mentioned earlier across all of the different roles. And what we found, not surprisingly again, is that a very small percentage of our educators, less than 10%, were meeting that aspirational salary goal. Next slide. So this moves us into what is our data-driven strategy and policy design to fill that gap. So I'll start with some of the things that are currently in place. We were using stimulus funding. Colorado was able to launch a wage increase pilot for 300 teachers, raising them up to a living wage with increases of about $3 to $7 an hour. And we were able to do a rigorous random control evaluation that found that those pilot teachers faced less financial hardship and food insecurity, had greater job satisfaction. A lot of them quit second jobs and were retained at higher rates, especially for those who had more experience or more education. And notably, the reduced turnover costs more than outweighed the administrative costs of this program. And we also learned a lot about implementation. And so to Ola's point previously, this is kind of a one pilot, but what we are doing with this grant and our work together is trying to figure out then how that can inform the fundamental shifts that we need for a statewide ECE compensation initiative. Next slide. Colorado has also invested in tax credits to support our early educators, while the vision is ongoing increases that educators see in their paychecks every 2 weeks. Due to Colorado's unique constitutional revenue limits, refundable tax credits have been a really vital mechanism to get money into the pockets of educators right now. So in 2024, we had 16 or almost 17,000 educators who received a total of $34 million. And that credit also successfully incentivized our educators to obtain their credentials or increase their qualifications, which was really exciting for what we see happening in our classrooms and our homes. And starting this tax season, the ECE credit is kind of evolving into a new care worker tax credit, which will provide a $1,200 refundable credit to early educators and child care workers, including for the first time family, friend, and neighbor providers who we know are a critical part of the system as well. Next slide. Finally, and this is the real key and bulk of what we're focused on now, we are actively crafting policy recommendations to close that compensation gap, as well as looking at strategies that are cross agency to leverage resources to support early childhood compensation. And so we have a number of liaisons at other state departments who are looking at how we can support and leverage those resources. And then we're working with a broad range, two working groups that include a broad range of providers, advocates, researchers, local leaders to develop recommendations for an ECE compensation initiative. And I included just a few bullet points of kind of where we're headed based on some of the policy analysis of what's going on across the country. So looking at program level grants that are paid to increase wages for teachers and family child care home providers and directors towards moving them towards that living wage, pairing that really with coaching stipends and scholarships for our new educators, and then working towards a goal of universal access, but recognizing that with funding constraints, we advance with an equity-based prioritization that includes or ensures that funds go first to the communities with the highest need. So that's kind of my introductory slides. I'm looking forward to the panel discussion and any questions that people may have. Thank you.
Great. Thank you so much, Michelle. I'm going to turn it over to Candace and Rochelle from Louisiana.
Hi, good afternoon. Thank you for having us. So again, I am Candace Alfred Weber. I serve as Chief of Partnerships at the Louisiana Policy Institute for Children. So I am also looking forward to the discussion after our introduction. But for now, I'm just going to share just a brief overview of Louisiana's Early Educator Investment Collaborative, or EEIC, and just really frame how we're approaching compensation across the state. So next slide. Oh, you can go to the next slide. If you're not familiar with the Louisiana Policy Institute for Children, essentially we are a nonpartisan public policy think tank. We sit right at the intersection of policy, practice, and partnership, which is especially important when we're talking about workforce and compensation. And so really our role is to provide data, research, and partnership support that helps policymakers and communities make informed decisions. Next slide. And so this is just a snapshot of where we began when we started this journey, really growing our body of work around compensation, early educator compensation in Louisiana. So our teachers were making an average $9.77 per hour, often lacked access to benefits, turnover exceeding 75% every 3 years. And we know this creates instability in programs, for families and for children. And we also know that these conditions don't really reflect the importance or the skill of the work and it certainly isn't sustainable. Next slide. And so, thanks to the Early Educator Investment Collaborative, we were able to create our own steering committee, which we call the Louisiana Early Educator Investment Collaborative, which we manage, supported by the grant. Of course, the goal is to advance sustainable competitive compensation for early educators, especially those in community-based and home-based setting. And so this collaborative that we formed, for the state is a key strategy as it relates to early educator compensation within Louisiana's broader early childhood systems. Next slide. And so, as Ola mentioned in the beginning, one of the requirements for the grant was that we had a cross-sector partnerships to figure this work out. And so I think this is one of the strengths of our EEIC as far as who's involved. And so as you can see here, we've brought together state agencies, local governments, higher education, Ready Start networks across the state, providers, and early childhood educators themselves. And so, this certainly isn't a single organization effort. It is truly a table built intentionally to reflect complexities of compensation work. Next slide. In this steering committee, we do have our own values and guiding principles that was developed as a collective. And so it drives every decision that we make. And these guiding principles really push us towards sustainable funding, based compensation. So again, not one-time bonuses or one-time funding, and really ensures educators' voices when we're shaping both design and implementation. Next slide. So in Louisiana, we put out an RFP to the early childhood systems across the state. Communities know what they need. And so we were looking for demonstration projects that really focused on one of three main areas. And so that was increasing wages, expanding access to benefits, or addressing cost of living pressures or benefits cliff. And so the idea was really around testing strategies that could meaningfully improve compensation, and then, of course, generate lessons that can inform long-term policymaking. Next slide. And so this just wanted to show you all, we are highly engaged with all of our award recipients. All of the projects required that they engage directly with early childhood educators. They have to participate in third-party evaluations so we can understand what's working. And then regularly share lessons learned. And so in Louisiana, with this group, we've also formed like a localized community of practice where they can, share their learnings, learn from each other as well. And so for us, it really wasn't about just funding projects or programs that led us to increased compensation, but we also wanted to build knowledge, transparency, and really accountability for the field and for policymakers so that they can learn what truly works. Next slide. And so we had 7 grantees across the state. This is geographically diverse. We have rural and more densely populations represented here. These demonstration projects range from, developing comprehensive benefits packages specifically for early childhood educators based on what they want to, working with providers themselves on their financials and seeing where they could allocate funding to increased salaries for their staff. And so you'll notice one is in bold. And so this time I'm going to turn it over to Rochelle Wilcox, who is the CEO and co-founder of For Providers by Providers. And I'll let her talk you through their particular demonstration project, which is scaling the fastest amongst all of the demonstration projects that we have in play.
Good afternoon, everyone. Again, my name is Rochelle Wilcox. I am the CEO and co-founder of For Providers by Providers. And so we're really excited to be one of the demonstration projects that is under EEIC and LPIC. So For Providers, just give you a little bit of background. For Providers by Providers exists because childcare providers have been asked to continually subsidize everything on on our backs, and to fix the workforce challenges without tools, infrastructures, funding, or voice to do so. So we are providers. We're the only provider-led nonprofit in the state of Louisiana that supports specifically Type 3 early learning centers, what are centers that take public funding. And we do that through advocacy training, leadership development, business acumen, as well as workforce demonstration projects. So our guiding principle is nothing about us without us. If we want to solve compensation issues in early childhood, providers must be a part of designing and leading those solutions. So through the EEIC and LPIC grant, For Providers by Providers understands that compensation is not just about increasing dollars, it's about building sustainable systems that allows providers to invest in their workforce long term. So we can go to the next slide. So what does this look like? So we have a peer-to-peer business cohort that lasts approximately 6 months. What you're seeing here is some of the work that we're doing and some of our graduates. So the core curriculum, it is a curriculum. The core curriculum focuses on budgeting, internal controls, financial planning, enrollment, management, health and safety compliance, recruiting, hiring, staff, marketing, advocacy, and long-term sustainability. As Dr. Weber stated earlier, and as we know, this is not just a one-time throw some money at something and then the problem is solved. We saw all of those things happen during our opera days and right after COVID, and now we're seeing a financial cliff. So what we have learned in this is that you cannot raise wages in this fragile business model. So instead of we are talking about pay, we focus it on strengthening the business at its foundation of childcare programmings. So over this time, because we are providers, we understand their numbers and stabilize their operations. There is not, during our community, we have community of practices within inside of this cohort. We have been able to talk about, hey, we bumped our head on this particular policy. We had to look at our financials. The first thing we notice is that our providers often say, oh, wait, a budget? What is that? Or how do I create one? Or support me through that? And we know that in order for providers to be sustainable, we have to know what our numbers look like. We have to know that this is real time. What's going on? Where is there waste? Where can I improve? Because there is always not the guarantee of new funding coming in. So we have to look at what our current funding is and see how we can adjust or where there is waste. So looking at your bank statements, do you have a CPA? Do you have an accountant? What are you doing? So that way we can start looking at real numbers and adjusting from that. So we've been able to support 22 provider fellows across 14 parishes. We can go to the next slide. 22 provider fellows across 14 parishes, delivering hundreds of hours of coaching and building communities of practice where providers learn from other providers. So as a result, we've seen 80% of our participating providers increase their revenue and enrollment, and 45% were able to raise wages and or add a benefit for their staff. One of the key components that we see that providers are often afraid or not taking advantage of is the child and adult food program. They are often afraid of or concerned around the reporting and the documentation. So we literally take time and go through the food program for our providers, supporting them from beginning to end so that they can get onto the food program. And that opens up an additional line item of funding. So then they can take that. And often what we've seen is that providers are not paying themselves. So the first thing we say, in order for you to be in business, you have to pay yourself. So that is our first line item that we make sure that they carve out for themselves. And then what does that look like in raising your salary, your staff salary, or giving them one PTO day, or what that might look like inside of the budget that we've set forth? And so We also give, again, handbooks, toolkits. Because of this, because of the grant, we've also been able to provide scholarships to our fellows around several of our workforce initiatives, which is the Early Childhood Teacher Corps, which is a partnership with AmeriCorps and For Providers by Providers, where we are able to support them with funding or paying a new person to come into their center where they're not strapped in that way, or that funding is not 100% of that funding is not coming out of their current budget. They only pay about $5,000 for a 10-month program that will support them in not only developing, but getting a new teacher on their staff, as well as our apprenticeship program that also supports and fund for raising the wage, and as well as providing providers with support in that area. Beyond those numbers, what we've seen is that a change in morale, that I can do this, I can to be sustainable. This is how I need to work more effectively. We've seen stronger team cultures, higher retention, and educators who feel valued in the profession, not just as employees. So 4P also invest in the continual workforce. After they are finished with this 6-month cohort, we have monthly calls. We actually have an additional support group, so that way we can make sure that they are sustaining throughout the rest of their business. This work proves that compensation is possible when partnership is intentional. When philanthropy, state agencies, provider-led organizations work together, we move them from pilot programs to lasting change. So when we talk about progress through partnership, we really mean this. We are building an ecosystem where providers are equipped, educators are valued, and families are supported. Thank you.
Great.
Yeah, so
Thank
that's
you.
just our information. I mean, I know we'll have more discussion, but if you guys just want our contact information, we are providing it here. Thank you.
Great. Thank you so much, Louisiana team. I'm going to turn it over to Angela from Minnesota.
Hello, everyone. Thanks so much for having me. I'm excited to be here to chat a little bit about some of the compensation initiatives in Minnesota. So we can move on to the next slide. And we just wanted to ground our conversation in the vision that kind of guides us in this work in Minnesota, which comes out of the One Minnesota Plan, which is kind of a statewide strategic plan. It covers a lot of issue areas, not only early care and education. That was put together by our governor's team when they first stepped into the governor's role. But one of the goals in this plan is around all families in Minnesota having access to affordable, high-quality early care and education. And there's some components of this goal, including creating a system in which family costs are affordable, ensuring that access is not determined by a child's race, family income, or zip code, and ensuring that early childhood educators and care providers are qualified, diverse, supported, and equitably compensated, regardless of setting. And so our compensation initiatives that I'll be talking about today are really firmly in that third category around support for early childhood educators and care providers. But of course, we know that all of these components affect each other, and any solution that we propose to one has to also work together with solutions to the other challenges as well. So we can move to the next slide. A little more context for our compensation work in Minnesota, just to kind of give a sense of timeline and how this work has shifted in recent years. There was mention earlier on in this webinar of a case study coming out soon, looking at the compensation work in Minnesota. And in this case study, a helpful way that the folks working on that case study organized it was just kind of looking pre-2020, things that developed during COVID relief, and then how have those things evolved post-COVID. And so pre-COVID, we had some compensation work in place. It was something that was definitely on the radar. People were working on it. Examples include retain wage bonuses, which is like a lottery-based wage supplement program that's been longstanding in Minnesota. Teach scholarships, which provide funding to educators to pursue additional education. But the pre-COVID funding for these programs did not allow for all eligible applicants to receive these supports. And these supports were really kind of one-time relief as opposed to more extensive compensation reform that really changes the baseline of how compensation looks. During the height of the pandemic, of course, we quickly activated several programs to sustain the market as it faced a crisis. We used ARPA funds to create the Child Care Stabilization Program, which I know many states had. In Minnesota, one unique piece of that was that we required 70% of those funds to be put toward increasing compensation for the workforce. And that was really a strong step toward how that work evolved post-COVID into something called the Great Start Compensation Support Payment Program, which Sophia has just put a link in the chat to that website. Thank you. And that program is really kind of the successor to the COVID relief grants, but is focused specifically on compensation. So Great Start Compensation Support Payments are direct payments to childcare programs. More than 70% of childcare programs in Minnesota are participating in this program. And that money goes directly toward compensation for the childcare workforce. And we've been able to sustain that investment after the end of the federally funded relief program with state funding. And so that is an ongoing program in our state. We also have seen the awareness and importance of compensation in early childhood growing in many spaces, not only in on our own team, but for example, our Department of Employment and Economic Development has launched a childcare economic development grant program, recognizing how critical childcare is as an infrastructure support for our whole economy and businesses around the state. And those economic development grants can be used by communities for a variety of purposes, but including to put toward compensation for early educators. Another big shift that's happened in Minnesota that has affected and shaped this work is the creation of Children, Youth, and Families. So that's what DCYF is standing for in this slide. This new department was officially launched at the beginning of fiscal year 2025. Yes, so in July 2024. And it brought together programs that serve children, youth, and families, primarily from the Departments of Education and the Departments of Human Services, but also from several other departments, including the Department of Health and Corrections, and brought those teams together in this new department with a goal of better aligning and coordinating services using a whole family systems approach, and recognizing that the work we do in any one team within this landscape of supports for children and families affects how families interface with us in other areas as well. So we're trying to reduce silos so families can more easily find the support they need to thrive. And as I mentioned, this agency launched officially in 2024. So we're definitely still settling in as a new department, getting all our systems in place, but there's a lot of exciting work happening around aligning and building on long-standing efforts that had been in place at coordination across agencies. You can go to the next slide. So now that was kind of a lot of context about what's going on in Minnesota, but I'll speak briefly about a few specific initiatives that are really focused on compensation that have been developing in the past couple of years. So the first one I'm going to talk about is the Early Care and Education Wage Scale. And this work was, thank you, we just have a report in the chat relating to this wage scale work. This was a legislatively mandated project asking our department to research and do engagement in the community and put together a proposed early care and education wage scale. And After significant work and engagement with the field, we've put together a wage scale that includes these 5 components. So it includes a base level of the wage scale, which is based on the cost of living. And so we're essentially saying no one working in this field should be earning less than this base wage, which would put them at kind of a living wage level. This cost of living base wage would be updated each year, and that adjustment would be in addition to a pay raise that would come with increasing experience. So you start at the base wage, your wages are increasing with your experience in the field, and we're also adjusting that base wage over time to keep up with inflation. We also built in regional variation for cost in 4 categories. So we categorized the regions of our state into 4 areas: rural, small town, large town, and urban, and looked at how costs vary across those different groupings, and adjusted the base wage and the wage scale based on that regional variation. And we also aligned the wage scale starting from that base wage and then moving up, aligned the steps in the wage scale with parity with K-12 educators, so that someone working in early care and education with similar experience and education to a K-12 educator should be earning the same amount, similar amount. And we also looked at benefits as part of a full compensation package, and built in recommendations around that to the wage scale as well. I think, as one or both of the other states mentioned, just creating a wage scale does not necessarily mean that we can implement it unless we have the funding for it. But we know that it's a really critical step toward transformational compensation reform. And so just thinking about kind of where does the wage scale fit into that broader vision for overall compensation reform. We know that if we did get the funding to fully implement a wage scale like the one that we propose, it could bring about that transformational compensation change that would truly affect the broken market that we see in early care and education. It would match up an individual's qualifications with their expertise, and their formal education credentials and their lived experience, and help lift the workforce to at least, at minimum, meeting the cost of living, and ideally recognizing the value that they bring into this work and fully compensating for their education and their experience. We know then that the resulting increases in compensation can help ease recruitment and retention struggles in the field, which would contribute to a more stable workforce and a more stable childcare market, which would improve the quality of experiences for children in childcare. And we know that any wage scale implementation must be part of a more comprehensive solution that also addresses family affordability and keeps the well-being of children at the center of its efforts. So we know developing the wage scale is a first step toward that. Working toward implementation of that wage scale is the next step. And then both of those things would have to be part of an even broader effort toward a system that works for both educators and for families. Okay, I'm going to talk about one more initiative, which is the Pay Equity Pilot. And this is a pilot that we ran last year in 4 Minnesota communities. So it was a pretty small scale pilot, but it was a really robust way to test out implementation of the wage scale. We actually did the pilot before the official wage scale that is linked in the chat was completed, but this helped us really inform that work and see what something like that would look like in practice. So we selected 4 communities in Minnesota to participate in the pilot. The pilot took place over the course of 3 months in the summer. And during the pilot, participating educators from eligible programs received stipends that would raise their pay to what the level that it would be on a proposed wage scale. So we developed a wage scale for the purposes of the pilot, looked at educators' current level of pay, and then paid basically the differential between their current pay and what they would be paid if they were if we were using the wage scale in practice. And so we used federal grant funding to run this pilot for the 4 Minnesota communities. And we were able as well to really build in a robust evaluation plan as part of this pilot, which helped us collect a lot of data as part of developing the pilot, during the pilot, and in some follow-up work after the pilot with participants. And although it was a small and short-scale pilot, it as I mentioned, it helped us inform the full-scale wage scale that we put forward to the legislature. And it also, we could just really see the deep impact of this, even in the course of 3 short months of providers receiving these payments. So I'll close out here with, I just have a couple quotes on the next 2 slides that from participants in this pilot. So one person said, I feel like I am finally earning what my job is worth. I have been a licensed family childcare provider for 32 years in a small community. I try to keep my rates affordable for my families, and I am always at my legal enrollment capacity, but I still often find I am barely getting by and not really getting ahead. My expenses continue to go up, and I cannot raise my rates enough to make up for that. So really seeing the financial challenges. And then if the pay equity payment were as a permanent thing, I could get more extra items for my program and maybe have enough savings to protect me if I am ever not able to work for an extended period. As I get older, this is a big fear because I do not have unemployment or disability benefits. I also feel like the pay equity pilot program has recognized how hard I work, the amount of hours I put in every week, and the value of childcare providers. So I will wrap it up there, and I'm looking forward to the discussion and any questions.
Great. Thank you, Angela. Loved ending on those quotes. We don't have too much time for discussion. You all had so much information to share, but I think we have time for 1 or 2 questions. I've also seen folks putting questions in the Q&A. Thank you for that. Our speakers have been answering some live, and we'll try to include some answers in our follow-up email as well. So with our last few minutes, I want to ask our state speakers to come on video for a quick discussion. I have one question that I want to start with you all that I think is often top of mind when we talk about this topic. And as Dr. Friday shared at the start, a key focus of these grants was really thinking creatively about how we finance investments in the ECE workforce and in compensation specifically. So just curious to have you all share a little bit more about what challenges and successes you faced in financing your state's investments in compensation. And feel free to, whoever wants to speak first.
I'll jump in from Louisiana. So, one of the biggest challenges, hasn't just been finding sustainable funding, but I think the first thing is really shifting how people view the work. It's really hard for them to see the justification of long-term funding if they just see it as babysitting, right? When we know it's really economic and workforce infrastructure. And so that has been a lot of the work, trying to educate and really being very intentional about the messaging about the work that our early education educators do in the state. Rochelle, I don't know if you'd add anything to that.
So I agree 100%, but it's just not outside stakeholders. It is also supporting providers to understand that you are a small business. We, again, as providers, often come into this to support our communities. And so when those parents or people come, it is just like, okay, I'll pay you next week. Or can you take this? And so helping providers understand that this is a business model. You will no longer be able to be there for the community if you continue to not value yourself in a way as a small business. So that is one of the things. And I just want to add to what I said earlier, one of the first things is we have to show our providers how to pay themselves, right? And so that is the mindset shift that we are supporting the communities because we have to be here. We are the essential framework of the economy.
And I can jump in here as well. we know that we need additional sustained funding in order to truly make that progress towards the compensation goals, and that we're not having one-off investments. And one of the critical pieces has been thinking about first, how you design a policy that people can be confident in, but also making the connection between, kind of building off of what my colleagues from Louisiana just said, making the connection between the investment in compensation for the early childhood workforce, how that helps support childcare and early childhood systems overall, how that supports our whole, business community and our economy. And so we have been looking into, different advocates in the state, different tax ballot measures that might increase taxes, recognizing value that that would create for our community. And we've had some success in Colorado with a handful of local county ECE measures that have been successful. And then there's a look at, okay, how can we do that statewide to get a dedicated funding source that really is going to move the needle long term, and just to answer a few of the questions in the chat, that moves it towards where we can get to helping support increases in wages for all of our educators, not just a one-time pilot.
I can add a little bit for Minnesota. As others, as I'm sure everywhere, definitely face ongoing challenges with securing the consistent ongoing investments we need to really make sustained progress toward compensation reform. But a couple things that I would highlight just about successes in Minnesota. One is that I think we've been really successful in leveraging one-time and grant funding to build out the infrastructure to support those long-term investments, so that we're kind of ready to hit the ground running as we're able to build in more investment. So for example, we've done a lot of system building with our preschool development grant funds, and with this early educator investment collaborative grant to build both the people connection systems and the technology system updates that we'll need to implement a lot of these things like the wage scale. And then another area of success that we've seen has been building compensation increases into any new initiatives where we can. So, for example, our Department of Labor and Industry recently added childcare as an industry to their dual training pipeline program, which is similar to an apprenticeship program, and that requires a pay increase for participating workers. And then earlier I mentioned our Department of Employment and Economic Development childcare economic development grants, which include compensation as a potential use for those funds. So just finding anywhere where we can connect that compensation piece in with any investment that's being made.
I just want to add one more thing. I know we have 1 minute. The fact is that we in Louisiana also have the Early Childhood Education Trust Fund that sits at the state level. We have also been successful in 13 parishes across the state of Louisiana to get that dollar for dollar match. If the municipality raises the funds, then they get a dollar for dollar match in the state matching fund that has lifted up our early learning center providers and being able to not only increase the tuition rate that they're receiving, but their wages that they also for their staff. The one other thing, and during this process, we've also found several other parishes that are interested in participating in it, and we've been able to support them that way as well.
Great, thank you. We're just about at time. Maybe to close this out, I'll just ask each of you if you have one thing that you'd want to share with any other states or communities on the call who want to start working on compensation, any advice or things you've learned that you think folks should know.
I would just say biggest advice is this is collective work. It must include early childhood educators. You can't design compensation systems or create policies without the people living in them every day. So start by listening, build shared ownership across sectors, and don't try to do it alone.
I would say don't let how big the challenge is stop you from starting with something. So I think it's important to go in with an overall analysis of the full problem and understand the full scope of it, but to then pick apart and start working on it, and make sure that as you scaffold things together, they're all moving you in the direction of that broad vision that really takes into account the full problem that we're trying to solve.
All right, Michelle, anything you want to add in closing?
Oh, sorry. I know we're right at time. But I would just say, yeah, thinking about how we leverage all of the different expertise we have in our community. So the educators, thinking about as well, bringing together leaders across the community is going to be really important as we think about how we can get sustained investments into our early childhood educators and our whole system.
Great. Well, thank you all. I'm sorry we didn't have more time for the discussion, but thank you all for sharing. More to come from this community. We will follow up with resources. I saw a lot of questions about the wage scale, and we actually just released a blog post about how these states are using wage scales. So we'll make sure to share that out with folks. Thank you all so much for being here, and I'll turn it over to Ola if you want to say any closing remarks.
Oh, thank you so much, Arabella. No, just thank you to all of the speakers. Thank you for all of your hard work. This was such an inspiring conversation to hear all of the exciting strategies and things that you are putting into place to really tackle this compensation challenge. So it's so timely. And so we've learned a lot and more to come as we continue to share out the good work that you're doing. So thank you.
Thank you, everyone. Have a good rest of your day.
Thank you. Bye-bye.